Thank you for watching Lira Scoop. We are glad you are here.
Zero. Happy Women's Day.
Doing sub-county. Aquela tem na tida tá no acidente. A bina foi o bama tien. Me tua ko pode borre. Pequena bela manene wa. A moti yene. Da me foi o bam. Ni me da chengu chero boom. Pien ja konyo na hawan jo dusu petia poko. Ni a leptong nyo lera ke ken. Wan dusu ki din kala chien. Ko pe pistola ni. Ani koma ni ya wana hamasaha ya woto ya ye kono masaha eto kada neno to gere kiti ni ya do beda yom ni mon wala dusu abindo kello kan ka gyo no red ki beta na wala ye masaha te kwayo ni doctor Lakisa ka no wi ko copy pe kul wi pin ba jare ko ka ko ken cha ti menang be wuti mi wa wanang a leptong ba kita chengu tia temo kedeni ba me pol mi wu
na la tie pien ka yacha no yat ya ding eto kita donyo keda neno yati pa no ding to twal cha moro ka yini bera to ya tuo iramo peto ka buruni lange tana tuo kanite buru pe ba kita mo bere wani kede kucha ame no space petie kom no tia ding ame kade bino una rio mir ngara chel dong donyo ngara chel dong ita bere le baket tu tem kede kan ka yang tuo ni katora tuo ti yi ora yang ora pala kucha ngata mi to nena tin tu eto man ni ramo bere uno kom space tie yama pol tie ye kom nena la chere kom yo mo ya tu twal
like this marks a very big milestone and speaks volume to three things. One, that there must be commitment in what we do. And we have seen this through the Musa project that emanated from Bahrain University of Science and Technology. Two, it tells us that partnership is very important. Now, don't mutiko perana hachon. This year, shall Timomo. So you need many hands. Your hand alone, you will not be able to meet the demands within your area. So today is telling us that partnership is very important. And we are very happy to continue to partner with Bahrain University, Science and Technology, as we develop now as a people. Through the Musa project, we are here seeing a lot of development, expanding the gynecology services. And on that note, join me in congratulating Professor Musa Kayondo and the team from Bahrain University. I have informed you earlier, was supposed to end in May this year. But you can imagine we are here in the early weeks, the early days of March to deliver this project. And this means that we have been able to work together and deliver this project within record time. We started in November last year. and we are here celebrating such a big infrastructure. This building costed 600 million shillings. It has the structure that you have seen, the equipment that will come along, which is still on the way, and the furniture that we have been able to see within the structure. The minister, every year, we deliver 8,400 women here, on average. 8,400 women, pregnant women. I'm aware that as a country now we are around 2 million deliveries a year as a country. So we are contributing 8,400 to the 2 million. That is only for the regional referral. But when we look at now as a region, it's much bigger than that. Out of the 8,400, 25% of them are operated. So that gives us a number of about 2,100 undergo cesarean section. Now, that ward where women who deliver through operation stay has a capacity of 21 beds at the moment. Our cesarean section, those who can do mathematics, if you divide 2,100 by 12, what do you get? Around 36. You do the mathematics, but what I'm driving at is that the space is not enough. We struggle with the mothers who have been operated to the extent that we now start to weigh and yet your time is not yet ready to be discharged. We need space for more to come. So 25% of that number will require a bigger space in the near future. 175 per month. So on average, 200 cesarean section performed per month here. Now, last year, together with Minister of Health and UNFPA, we discovered that now sub-region has the highest backlog of unrepaired fistula in Uganda. Another pelvic floor abnormalities. Now sub-region. No wonder this building has come in time. So what does it mean to have an unrepaired fistula in the community? It means we are having a section of mothers who have been chased away from their marriages because they're eating urine, they're eating fecal matter, they're having their genital organs collapsing outside, their husbands have run away. And Lamu sub-region, therefore, is having that number of women very high. Unrepaired problems around reproductive system, which should have been repaired by all of us here, the health workers in the region. We should have started a long time ago. But the head of department told you that we started doing serious work around 2020. So the backlog is a lot. We will continue to work with the clinical services department. This facility will go a long way in strengthening our mandate as a regional center for excellence, as we continue to collaborate with the donors and other stakeholders, of course with our mother ministry, who is fully aware about our plight. The head of department and the staff who work in the Department of Obstetrics and Gynecology, the cry of these women, the cry of Lamu sub-region is that we must maintain that building very well. We must put that building to good use. the next time that we meet, we want to hear many success stories of women whose lives have been transformed through this infrastructure. Also, the area that we usually forget is to train the next generation. If we do not prepare the next generation of surgeons who will be able to work like Dr. Kayon, like Dr. Okelo here, and Dr. Omongo here, and Dr. Sister here, and the other doctors available here, the skill will die with the specialists. Once they die, it's the end of story. You can't, it's not genetically transmitted to your son. So we must take interest in training the health workforce so that we super specialize this region and we are ready to offer service to our region. As I conclude, we are fully committed as a regional referral to continue to improve the well-being of the mothers and their newborn. And indeed, at this point, I want to thank the Honorable Minister for Health for not forgetting Lira Regional Referral Hospital. Passion for excellence.
Fistula and other urogyn conditions. A lot of good work has been done here, but we had a lot of challenges to do with space. And today, me as a person, I'm really very happy and grateful for the work done today. I encourage the public here, the teams, to ensure that we should really fight teenage pregnancy, ensure that we actually support our mothers to deliver in facilities so that we prevent the complications. Urogyn conditions are not easy to be with because they cause a lot of stress. So I really want to thank the leadership of the hospital for the good work you are doing. Keep it up. Let us keep the fight. The vibe. Thank you very much.
Anyway,
Honorable Minister, we are here because of your call during your leadership in the Ministry of Health for super specialization in the field of health in this country. And not only super specialization, but decentralization of super specialized services in this country. Where are women? I'll talk because that's the area I know, women. Sorry, the men, but women. Where women do not have to move from one end of the country because Lira takes even patients from Karamoja region to move from Karamoja to Mulago or to Mbarara to receive the service. Most of our women don't know even how Kampala looks like. They will go to Mulago, it's very big, they will get lost there and come back without ever getting the service. So for us, this is a call, your call. We are responding to your call of decentralization of super specialized services in this country. The Mbarara University Eurogynecology program, which is based at Mbarara University of Science and Technology and Mbarara University of Science and Lira Regional Referral Hospital, has three components. The first component is treatment and prevention of urogynecological conditions. Urogynecological conditions are conditions which come as a result of childbirth, women giving birth. They get complications. One of those complications, the most devastating, being obstetric fistula, where the mother leaks urine or stool, or in the very unfortunate, they leak all stool and urine after a very difficult delivery. And sometimes they have lost their babies. After losing the baby, they are stigmatized, they are chased away from home. They have emotional and psychological effect and trauma. So these are the women we are really caring for. Currently, before we started this program, we had only 3 urogynecologists in this whole country, of which 2 were based at Monaco, and me as the only one outside Kampala metropolitan upcountry. So we are taking care of, we have a total of 24 million women who are susceptible of getting these conditions, and we only have had 3 specialists to take care of these women. So it was upon me and other people, Mara University, to start up this program. So this program trains, first of all, it takes care of these women, and we do this by doing camps and also routine care in different hospitals in this country, in the different regions. We are at Lira Regional Referral, which was our first offsite center in 2020. We're at Windy Community Hospital. We're at Jinja Regional Referral Hospital. We are at Hoima Regional Referral Hospital. Buyinja Health Center for in Namaingo District, for Busoga Region, and Masafu General Hospital in Busia District. Apart from the treatment, in terms of treatment, last year alone, the program did 555 surgeries in this whole country. We also extend the service to our neighbors, our very unfortunate neighbors, close here, South Sudan, where we go and also treat these women and have surgeries. Apart from that, we do training. We train, Honorable Minister, you know that in the new structure of public service, which you championed, there should be a consultant urogynecologist at every regional referral hospital. But even if we had that, you would not have anyone to employ because there was no one trained to do this. So it was upon us to start up the first accredited Eurogynecology Fellowship Training Program in the whole of East and Central Africa, currently based at Mbarara University of Science and Technology. Honorable Minister, we are currently we want to train gynecologists, at least one gynecologist in every regional referral hospital, such that we have a urogynecologist at every regional referral hospital among the 16 regional referral hospitals in this country. And we hope to have at least 25 urogynecologists in this country in the next 5 years. We are also preventing these conditions. Fistula, it's as a result of difficult delivery, women delivering, taking long in labor, or even the very unfortunate ones, where the women come to hospital and because of not having very good skills of some of the doctors, they get out with these complications. So not only were we preventing obstructed labor, but we're also training the doctors who are doing cesarean sections to offer what we call safe cesarean section, such that our mothers do not get complications in the hospitals. We do this, it's a program called Essential Training in Operative Obstetrics and Gynecology, which we do here at Lira, Mbarara, and Nakaseke and Soroti. So that's in training. We're also building infrastructure, because training the doctors without infrastructure is very difficult. We will not have a sustained service. So that's how we have come up with this project called the Musa Project, which is based by our partners in San Diego, United States of America, where we are building a fistula and urogynecology ward from our traditional gynecological wards, which were having capacity of 10 to 12 patients, to at least 50 patients, where these patients recover with dignity. You can see the ward, it has cubicles, there's privacy, it has an HD where the very sick mothers who have these very difficult, life-threatening obstetric complications can be handled and monitored from. So that's what we are building. And we are very happy that the first regional referral hospital, minus Mbarara, to have a dedicated urogynecology and fistula ward is Lira Regional Referral Hospital. As I've said, apart from the infrastructure, there is also equipment. It's very bad to have such a building and we don't have equipment to take care of the women. And we also have a project called the Project Cure, which is going to give us, already the equipment is already packaged from the USA, a container full of equipment. Both theater, ward, and ICU. Not only even gynecology, but there's even equipment for urology, for pediatric surgery, general surgery, all fall in that container. And I really want to thank you for helping us facilitate to go around the bureaucracies which are required in clearing such equipment. Thank you so much. So I want to...
Today, the 7th of March 2026, we are privileged as the people of Lango, because today we have commissioned a new ward, and that is the Gynecological and Fistula Ward. This ward was constructed with support from a project under Mbarara University, College of Science and Technology. Because of the high numbers of mothers with fistula cases in this region. The construction started in November last year, and it has costed 600 million Uganda shillings. This has expanded the capacity of the former Gyne ward from 12 beds to now 45 beds. It is still small, but it is better than it was before. We are also grateful that in addition, there is a fellowship training that is ongoing to impart skills to our obstetricians and gynecologists so that they are able to attend to our patients with fistulae. There is a very high number of fistula cases in Lango sub-region because, again, of the high prevalence of teenage pregnancies. And for a long time, it has been a problem, because I recall in the early 90s and up to the late 2000s, the early 2000s, Professor Brian Hancock from the United States used to come to support these women. But we are now excited that our doctors have the skills and we have a ward where we can take care of these women. My passionate advice to our girls is that we should avoid teenage pregnancies, and we should avoid pregnancies when our bodies are not yet mature enough to carry such pregnancies, because that is when we end up with a fistula. So we want to deeply, deeply appreciate this partnership, and also to congratulate the entire team of Lira Regional Referral Hospital, led by the director, Dr. Andrew Odur, upon this milestone.
Thank you for watching Lira Scoop. We are glad you are here.